All right, welcome everybody to Nutritional Frontiers Wellness Wednesday. This is NF Live. My name is Tracey Strauss, and I am the VP of Education and Marketing at Nutritional Frontiers. And with me tonight is Jamie Dorley, CEO and owner of Nutritional Frontiers. Hey, everybody.
Good evening, Dr. Tracey. How you doing tonight?
Good. And Joe Messino, AKA the Godfather of Nutrition, and also Facility Director at Weiner Wellness Clinic. So thanks for being here.
Director. I got another title. Hey,
wow, I'm just getting all these titles
coming all at you. And some people may know him as Joe Mattina. So if you hear that, that's Joe Messino. That's in Pittsburgh East, right?
Yeah, Pittsburgh East.
Yeah.
Well, it is an exciting time. We are in May already. I don't know what happened to May, but it's allergy season, guys. So we got some stuff to talk about.
Well, Cinco de Ocho is this Saturday, so I want to say a big happy 13th birthday, Joe. We're officially teenagers. Nutritional Frontiers has turned 13.
Should I sing?
Yeah, you might as well sing in your best Marilyn Monroe voice. Let's hear it.
Happy, happy birthday, baby.
Oh, very nice, very nice. We got the champagne bottles coming out.
Oh, mystery is solved while Joe's still single.
That is a mystery. Yes, it is.
This guy settles down all the time. You settled down last night. You settled down the night before. He settled
almost
down
every night.
Yeah. He's in love with you, Tracy. Come on.
I had to open that can of worms. You know me. So welcome, everybody. The chat box is open. You're welcome to post your comments. Keep them clean, unlike us.
Yeah, post your compliments. We like compliments, right? Yeah,
absolutely.
Compliments are good.
Yeah.
So what are we talking about this evening, guys? What do you have on the bracket for us?
Well, it's allergy season, right? It's Cinco de Mayo today. We got the big birthday weekend. We got the wellness week going on. As Mikey G told me recently, it is allergy season. You better be prepared. And we want to talk about some of the causes of allergies and some great solutions. So before we get into that, we got to talk about AirMax. This is without a doubt one of the best formulas on the planet for managing allergies, and it works in so many different ways. And there's some secret weapons in this formula, Joe.
Yeah.
And one I want to get, because some people know about vitamin C and quercetin, and we'll hit on those a little bit. But Tracy, one in particular is called Perilla seed extract, and we use something called Benigut. It's a patented, research, trademarked ingredient. And when you travel to Asia, I know Joe's been there many times, they put Perilla seed in just about everything because it works a couple different ways. It's an anti-inflammation and an antioxidant. And it really works well for allergies because it helps manage the release of the symptoms of the histamine release, right? So Tracy go into more of the science behind it, but that Benigut alone is a fantastic ingredient because it goes to the cause of the problem and it rebalances your immune system. When that's hyper sensitive and is out of balance, those mast cells just build up and they explode. And that's when you have some of the symptoms, right? Stuffy nose, itchy eyes, watery, maybe hives, those type of things. And it's one of the few ingredients on the market, natural or pharmaceutical, that actually addresses the core root of what's going on with this histamine buildup. So that in particular, that ingredient is fantastic.
And it's the perfect example, this formula and that ingredient, because like Jamie said, that ingredient is used by itself all over the world for that very reason. But it's only a component of this formula. So that's the difference. And that's what we always try to emphasize is that where everybody's using single ingredients, we're using multiple ingredients to maximize the effect of the formulation.
Yeah, that way you get the comprehensive solution, right? You can buy ingredients anywhere, right? But when you get the comprehensive formula, you get the synergy of all the different ingredients working together. I know when Tracey is in practice, she probably saw allergies quite a bit, right? You know, living where she does out in Tyrone.
In the sticks.
Well, you go to that end of the earth and it says Tyrone 10 miles ahead, right? So, but you see allergies all over. It doesn't matter where you live.
It makes it easier to hide the body, Jamie, just so you know.
That's true. You put 2 tree bodies in that. Right?
You got a big trunk, it fits a couple in there. Let's move them out of the way. But no, the AirMax is great because it works for symptomatic relief, and it goes to the core cause of what's going on, right?
Yes,
and it goes down, it cools
histamine.
down the histamine.
Yes.
And that's the key thing with something like AirMax. So I know many times during our workshops, Mike Gallagher would pass them out at the beginning. And I remember the one in particular I was at, I hear, oh my God. I was like, what happened? The lady goes, I can breathe. He had given her 2 chewables of the AirMax sample at the beginning of the workshop. And within 30 minutes, she got symptomatic relief. And we hear that quite a bit.
Hear it a lot. And it works on pet allergies as well. So that's something I've seen exactly the same thing happen. Somebody with a severe cat allergy who was able to walk into a room where there were cats, chewing a couple AirMax and not have any symptoms. So it does work fast, quick and fast. And that's the chewable delivery. I mean, that's the reason. It gets into the bloodstream immediately, right?
I thought you were going to tell us the cat told you it worked. So it was the person who had the cat allergy, right?
Yeah,
okay.
Cat allergy.
You never know, Joe. I know you got many testimonials over the years. So, Tracey, what about in practice? How'd you use the AirMax?
I thought it was really good for kids with allergies and kids that were on inhalers. It was one of the pathways that I used to help get them off of that. Of course, working with a licensed medical professional. But I really liked AirMax. And again, Mike, you gave me an AirMax while I was sitting there talking to him, and I didn't even realize that, I had any issues with respiratory. And once you get that, wow, it's like you can really breathe. And it only took about 10 minutes. So it was a good, way that Mike comes in. He's like, hey, doc, I want you to try this AirMax at the beginning of it. And then as we're moving through, talking about the products and what's on special, I was like, this stuff really works. So I used it that way. I did use it a lot for hives. I would have them chew in between different detoxes or whatnot. And they would chew the AirMax because it's kind of like a free radical scavenger. So as we were having die-offs, we would use that as well. You guys all right?
I don't know. Can you still see us?
Yes, we can see you.
Okay.
Oh, okay.
Our monitor is going a little bit.
It's okay. We'll pick it right back up.
Yeah. You're good. So I want to talk a little bit about the Activin that's in this. And Joe, I know that you talk a lot about this. So would you mind just covering what Activin is and how it works?
He loves Activin. Let's hear it, Joe, because
I love it.
This is the most research studied, trademarked grapeseed extract on the market. So let's hear about that, because people hear grapeseed, it sounds like it's so common and not exciting, but you don't think so.
No, not at all. I think grapeseed extract by itself is one of the greatest antioxidants we have at our fingertips. But the Activin version, the patented, research, trademarked ingredient, Activin, has been around for a long time. I mean, we've been in this industry a long time, and I remember this ingredient being around in the early 2000s. So it is the only and the most studied grapeseed extract. Now, why is it important, especially in this formula?
Great question.
Okay, it's important because nothing improves the integrity of the artery walls, veins and arteries, better than grapeseed extract. So if you're reducing inflammation, if you're clearing the airway, you want the artery walls to be as strong and as fortified as possible to handle the additional blood flow, which is going to create better oxygen throughout the body.
And over 90 published research studies, peer-reviewed journals, and they actually studied against vitamin A, vitamin C, and vitamin E, and then collectively those three together.
Yes.
ACE, right? And it outperformed all of them for antioxidant capabilities. Right. I think sometimes we hear antioxidant, and again, it's not a sexy word. It's like antioxidant, big deal. But when someone's inflamed, right, when someone has allergies, talk about all the oxidative reactive species that's going on. They need a really good antioxidant.
Yes.
They clean up all this debris and all this oxidation that's going on. Talk about that little joke.
Yeah, because
again, antioxidant, people don't get really excited when they hear
it falls into the family of proanthocyanidins, which is a really unique and powerful group of antioxidants. And it comes mainly from fruit, mainly from grapes. You know, grapes, the greatest fruit in the world. It was the first crop planted after the flood. Did you know that, Tracey? It's in the Bible. It's actually.
Were you there, Joe?
I read about it.
Oh, okay.
Well, they need wine.
Yeah, why knew how important that
And
was.
look, he even has the purple shirt on tonight. Usually I'm wearing purple. He's wearing that. That's his Activin shirt.
It's my Activin shirt. You got the seed of the grape, you got the skin of the grape, where resveratrol comes from. So it's phenomenal. And again, as a standalone great ingredient, it's a component of AirMax. That's what makes this so great. And it doesn't end there.
No, we have some of the more commonly known antioxidants or anti-allergens, such as vitamin C and quercetin.
Mm-hmm.
So we include that in the AirMax. And of course, we have a couple other ingredients that are very unique, like DMG. Right, named after, again, Dr. Mike Gallagher. So DMG, without a doubt, one of the key nutrients, because 5 U.S. patents on DMG.
Mm-hmm.
We have a whole book on DMG. Most people hear it. They don't really know what it's for.
Nope.
But we always say darn mighty good when in doubt. That was termed by Dr. Edwin Lee, because it works so well in so many different capacities. But in this case, we're trying to use it as an anti-inflammatory and a really potent antioxidant.
Potent antioxidant, and again, it goes right back to oxygen utilization. Nothing increases it, nothing improves it better than DMG. So you're increasing the artery wall integrity, you're reducing histamine, you're increasing blood flow. Well, and that blood flow is going to carry oxygen. Why not maximize that process by adding DMG to it, which maximizes oxygen all by itself?
Tracey, what are some of the common allergens people came in with? Because I hear this all the time. I'm out and around and people say, oh, my allergies, right? They just have accepted that it's standard, right?
Yeah.
So what are the more common allergens that people came in with?
Well, I think, probably the most common that I saw in kids was peanut allergies, which was pretty extensive, milk and gluten. In the environment would be pets, cat dander mostly. But, the one that always intrigued me was grass. Like, how can you be allergic to grass?
Yeah, that's what was in my head, yeah.
But we have really high pollen. I walked outside. I said I was at a baseball game before I got on here. And, I went out and my car is in the garage. The door is shut. I open it up, I back out. My whole car is covered in pollen. And I'm like, man, it's just, and people really struggle with allergies. So we know there's a lot of other factors that can, attribute to having allergies, congested liver, sluggish lymphatic system, all kinds of things. But the AirMax can be something that you utilize daily, and you can use it safely, multiple times a day to, at least help you with the symptoms while you work through the root of the problem.
Yeah, I think that's the whole idea with AirMax. It can give you some of the symptomatic relief, because when you're struggling, right, no one wants to have all the watery eyes, itchy eyes, sinuses draining, that feeling of congestion. And like you said, even when you took the AirMax, oftentimes when people take this, they'll say, oh, I didn't know I had a problem breathing. Yeah. I didn't know I was congested, right?
Yeah, until you can breathe.
And until you get the full, oxygen capacity. And I think that's what happens oftentimes is people are struggling. They may or may not realize how severe it is until they start to get some relief.
Yeah, and I think that, a lot of times in our industry, we coach people to give it time. Nutritional therapies, they're not drugs. They take time. This is one of the exceptions to the rule. You will feel it in a very fast time.
So let's talk about some dosing. So we have the chewable or capsule. What do you prefer?
Chewable, 100%. I mean, the original formula was a chewable. Then we came out with a capsule too. Some people just prefer capsules, but you know what? Nothing gets into the bloodstream faster than the chewable.
And Tracey, which one do you like?
I'm afraid to say capsule, but chewable. Yeah, I use chewable because it's more versatile in my house, not because I like it better than the capsule.
Yeah, so either way, they both work well, right? You have the options there for you. They're really safe for kids to take. The chewable works really well for kids, easy to take, tastes great. So what kind of dosage are we looking at? I normally like to recommend 1 to 2, depending on how severe it is or want acute relief or not, and how often do we do those?
Well, if I had somebody with hives that was in some sort of, acute issue, I would have them chew 1 every 2 hours until symptoms subsided.
That's right.
Yeah, with kids. I mean, I'm not afraid to use nutrition. And I think, to your point, Jamie, we've become so fearful of it. And to your point, Joe, we don't take enough. And then we expect one capsule or one chewable to do the trick. And, sometimes your body needs more because it needs more energy to get out of the rut that it's in. So I would recommend that for like an acute issue. For kids, I would just tell the mom, like, when do they normally take their, inhaler? Let's have one right before and wait and see how they are. And then if you need it, absolutely, then you can use it. And what happened, it was like a weaning process.
Yes.
And then for people that just had overall allergies, I used it prophylactically. Like if they knew they were going to somebody's house that had cats, I would tell them, take 2. Chew one in the car on the way over and chew one as you walk in the door. And usually they were good to go. And I have to say, it does work. So it depends on what you're trying to address. For general daily use, 1 to 2 is fine. But for a child, like I said, one is fine. And some parents would even say, like, these are, big. Can I break them in half? Or, whatever they're comfortable with as well.
Yeah, I love that, how you can use it for multiple purposes, right? You talk about allergies, talking about hives, Dr. Wanda's popping in my head, what about asthma, right? So combining some of your therapies, right? His famous protocol for asthma is probably 80 to 90% success rate, right? Which is incredible. He would get kids off of dairy products or adults, and he would add in vitamin C, and then he created the AirMax with us. So it was get off dairy and take AirMax. I mean, so simple, safe, and effective, and over 80% success rate for asthma. That's no inhalers, that's no medication or anything. I think people have to raise their expectation of what health and wellness is, right?
Yeah.
That's one of my frustrations, that people just accept it. Oh, I get hives. Oh, I have a food allergy. Hey, I can't eat this, or I can't go out because of grass or the pollen count, right? Hey, you may have sensitivities to it, but don't accept it that it should be the norm.
That's right. And they've been conditioned to believe that it is the norm. And a lot of that comes from the industry, the medical industry. A lot of it comes from the pharmaceutical industry, because they got to sell products. Right. So, quercetin is one of, and as we're talking about it, is one of the few nutrients that actually outperforms a drug in that capacity. And it's amazing. I mean, how often do you hear about that?
And that's in the AirMax also.
Yeah, it's in the AirMax.
We didn't stop there. We added in the DMG, the Quercetin, the Perilla seed extract, vitamin C. And what about, I just was looking at this formula early today, and I remembered that it actually has elderberry, something they're recommended for lung function and COVID all the last year or so. So let's hear about elderberry, Joe, because I know that Sambucal.
Yeah.
That was Doc's old cough medicine, right?
Yeah.
So that's the active extract of the elderberry.
Not to be confused with Sambuca.
Well, they both could probably help, right?
Yeah, they do. They absolutely do. Yeah, elderberry's been used as a standalone for many, many years under that trade name. But it has the unique ability to address both bacterial and viral issues, and that's what always set it aside over the years. So a cold and flu season, it was a standard, So including it in this just turns it's in Immunomax too. Absolutely. For that very reason. Yep. For that very reason.
So we got great results with the AirMax. We didn't stop there. It's a complete comprehensive formula. We have bromelain in there, great enzymes to help with digestion and clear up any inflammation.
Right.
So awesome formula. Capsules and chewable. That's the foundation of our allergy protocol.
Right.
Safe and effective at any age. We have the chewables. If the kid doesn't have teeth yet, you can always crush it up. You can put it right in any water or food. Simple to take, safe and effective.
And we're talking about allergies, that's respiratory issues, right?
Yeah.
And what have we been dealing with for a whole year? Respiratory issues. So this should be part of everybody's daily protocol at this point to ensure that you keep the respiratory system working at high throttle.
Yeah, if you're not sure what to do.
Taste and smell, also damage to the lungs after COVID.
Yeah.
So this is a really important one to help restore both of those. So we have to remember there's nutrients in here that help, really enhance the pathways of oxygenation. Not just, it's not just like, oh, we're just going to vasodilate you like a drug. That's not how it works. It enhances pathways so that we can, get more oxygen, keep inflammation down, make those pathways easier. So this is a great post-COVID recovery protocol as well to take AirMax. And don't be afraid to take it. You know, if
right.
I know a lot of people that are on oxygen after having COVID.
Oh.
So, you know, chewing on these throughout the day, 3 to 5 a day, like that's where I would start.
Yeah, and we forgot to mention it does have zinc, the patented research trademarked Albion Track Zinc, which stands for the real amino acid chelated.
What doesn't it have?
It has it all in there. It's like Joe's sauce. Everything is in there.
It's
right?
in there. Just like
it's a one-stop shop, and that's what we do at Nutritional Frontiers. You know, that was the whole philosophy when we started the company with Dr. Weiner. Was that, hey, Joe, you know, there's all these single nutrients out there. It's too many bottles.
Yes.
And Joe's like, hey, let's start combining these nutrients together. He's a founding father. I don't think he gets that credit enough, right?
Yeah,
But-
founding father.
Yeah,
I was there day one. Yeah, I was there.
You're
Me
a
and Doc
negative
upstairs in those
and the gold
god awful chairs.
The gold room.
Yeah. Okay.
So the AirMax is a comprehensive formula, like a lot of Nutritional Frontiers formulas, and then we had some single nutrients too. But the other comprehensive formula I want to talk about, because often people think of allergies, they may not think of the inflammatory response with it, and that's the Nattokin Plus.
Yeah.
It's got a main ingredient of nattokinase, which is a great, what we call systemic enzyme. It works really well on an empty stomach or without food. I take this every day. We've had it help with any kind of blockage. And when you think of allergies, think of like there's congestion, right?
Right.
Not only in the sinuses, but maybe the lungs, maybe the eyes, maybe throughout the body, right? So let's hear about Nattokin Plus, Joe.
Yeah, nattokinase, great single nutrient in and of itself, and we're of course going to combine it with some great cofactors. But natto has always had the ability to improve viscosity, blood viscosity, without inhibiting coagulation, and that's the big selling point to this nutrient, because you need coagulation in times of severe trauma. Okay, you need to be able to clot, but you also need to have good blood flow. So instead of talking in terms of drugs and chemicals, this is a natural nutrient that keeps the viscosity going, but it doesn't prohibit coagulation, and that's a big.
And we're not making any
factor.
claims here,
No.
but the gentleman in there earlier, you know the couple I'm talking about, he had over 60% blockage in his main artery, carotid artery, right? And he didn't want to go on the medication because when he looked at the possibility of getting results versus side effects, he said it's only about a 10% difference. He said, I'm not going to do it for 10% improvement. He still smokes, this gentleman. We put on the Nattokin Plus, and the blockage went down to less than 30%. I was even shocked.
That's an incredible change.
Amazing, right?
Yes.
So I see him, how you doing? Well, I says, well, you look great. You're still alive, and you don't have surgery.
Exactly.
So that's the type of things Nattokin Plus can work for. Some people use it for blood pressure and cholesterol. In this case, we're looking at blocked arteries. We're also looking at inflammation and allergies. So Nattokin Plus has a great combination of unique ingredients, because we didn't stop with the nattokinase. This used to be 3 different products, Joe. We used to try and, do it a la carte. We put it all together. So what about some of the other enzymes in there? Bromelain?
Well, bromelain, but you got to talk about serapeptase, because, Tracey, this is so relevant today, isn't it? Because its ability to clean up these debris proteins.
Right.
I mean, how relevant is that in today's world? And
Well, no holding back, Joe. Come on. I mean, what's going on?
Go ahead,
This is
Trace.
some dude version here of you and Tracey. Don't be shy because I'm around. Let's hear it. I heard you guys in action.
Well, in practice, when I used it, I would use it systemically, but I would use it to eat foreign proteins, right? Any type of inflammatory response as well. So, anything that was circulating in the blood that may cause an antibody response didn't need to be there. I would use Nattokin Plus.
Wink, wink. Are you guys reading behind the lines here? Come on.
Well,
No, you bring that up. That's a great point,
Yes.
right? So let's talk about, seriously, foreign proteins, right? Because that can happen from a trauma, right? You bang your foot or smash your finger, you can have damage there, right? Like it's like a foreign protein. So you can talk about that a little more, because a lot of times people aren't really following that concept of foreign proteins. Why would they be there, these damaged tissues?
Yeah, well, the inflammation is good. You know, you want an inflammatory response to an injury or trauma. So your body's very smart. It's going to release these foreign proteins, and they usually can come from adipokines to stimulate the immune system to fire and to create inflammation. And then what happens is it's supposed to shut off, right? But what happens is people are already inflamed. They get injured. They add additional inflammation, and now we have too much. And you impede blood flow after a period of time. So you really need to, you know, move towards the direction of reducing inflammation and increasing blood flow. And that's why this combination is so unique, because you get both. You get what Joe was saying with the nattokinase and, you know, the foreign protein destruction with the serrapeptase. So it's a really 2-for-1 type of deal.
And isn't that a lot what they're seeing out there with these viral infections?
Yeah,
right?
You're getting deep vein thrombosis, right?
Yeah, exactly.
So formulations like, you know, AirMax that would have the Activin for the endothelial health, you know, formulas like this, the Nattokin Plus. And then, you know, just to clean up mucus and inflammation overall. I mean, mucus is good. It traps bacteria, it traps viruses, but long term, it becomes problematic in itself. It gets congested and dirty. You can use Nattokin Plus to kind of clean all of that up as well. It's safe for children. It's just an enzyme. You just break the capsule open and you put some into, you know, into water and you have them drink it. You know, I usually encourage parents not to put it in milk or juice because then you're activating digestion, and I don't want to use that. But I use this really heavily with Lyme patients. Because, and I'll tell you why, there's so many studies on nattokinase eating the biofilm around the bacteria, the spirochete. So Lyme has 3 stages. It is the spirochete first. It comes in as the bacteria. And then once that environment becomes a little bit hostile, it'll try to protect itself. So it forms into like a cyst. And then as we throw more antibiotics at it, it becomes really protective, and it actually starts to develop a biofilm. And that biofilm changes every 7 days. So by the time your body sees it and recognizes it, it changes on it. So Nattokin Plus can actually go in there and eat the biofilm. And if you're using it, you know, effectively and enough, then you can utilize, if you want to, antibiotic therapy, or you could use colloidal silver, or you could use oregano, you know, Immunomax I love to use. I also love to use Candy Kill.
Candy Kill, yeah, absolutely.
When you combine that with colloidal silver, the berberine can increase the kill rate of the colloidal silver. So it can really target that Lyme bacteria. And then you have oregano, you have thyme, you have all those scavengers of yeast that can offset any yeast infections. How many Lyme patients do you get that have like overgrowth of yeast because of all the antibiotics that they've received? So this is a great formulation, and it can be used so many different ways. You have an injury, Nattokin Plus. You got blood flow issues, Nattokin. You got congestion issues, inflammation issues, anything that's going to require, anything that really shouldn't be there. Because enzymes don't just break down food and build things. They are deconstructors, right? They tear things down that shouldn't be there. And we don't have enough enzymatic activation on our own normally to take care of something bigger than a normal invasion. So you have an encapsulated protein, you have foreign proteins floating around your body, you have allergies, congested blood, dirty blood, right? I mean, what is that? Your liver's not filtering properly. Maybe it's overwhelmed. So you can use Nattokin Plus to kind of clean up the blood until you take care of the liver congestion. So it just really depends on how you want to use it. But I've used it several different ways, and it's always a staple in our house with boys and injuries and bruises and ankles and whatever else they do.
I think when we look at the cause of chronic disease, right? The cause goes back to chronic low-grade inflammation, right? So you get this chronic inflammatory response, and this could be from environmental factors, from stress, from food, what you're drinking, everything that you're doing on the lifestyle. That's why the NF for Life program has been so effective, folks. If you do nothing else, start with the lifestyle therapies, right? Because this low-grade chronic inflammation leads to all chronic disease, including the biggest killers, which are cancer and heart disease.
Exactly.
Right? So the problem is that if you don't address that over time, that low-grade inflammation, as you had mentioned, Tracey, creates the inflammatory response. And now you have all these byproducts of this process. And that's where people suffer. And they think, oh, the diabetes started today. The heart disease started today. No. This has been going on a long time, and now it's manifested in some symptoms.
Right.
Just because you get the symptom today, don't think that the origin was today
or yesterday, right?
Right.
It's been taking a long time.
Yeah, it takes a long time. Think about somebody who smokes cigarettes, right? It's low-grade chronic inflammation for 20, 30 years, and we've all seen our family members suffer from this.
Absolutely.
And then it manifests in the lung disease or heart disease or cancers, and they're like, oh, I just got this. No. This has been going on for years, and now the body can handle a lot of abuse, but over time, I think the biggest thing that people are dealing with now is what they're eating.
Mm-hmm.
This chronic inflammatory food is the #1 killer in the country. You would think they'd be shut. I mean, looking out the window here, this is fast food alley, Tracy. They should be shutting down these quote unquote restaurants, they call them very loosely, right?
Yeah, very loosely.
Because that's what's causing this low grade inflammation. And Nattokin Plus can go in there and clean up this undigested food, this damaged protein, this hurt tissue, right? And it can be something that's acute or chronic. So I love this formula.
So do I. Great. It was a great addition. Nattokin's been around, Nattokin Ace, but this formula takes it to the new level, as we usually do.
Yeah, so I love the AirMax we have. We have Nattokin Plus. Let's look at a couple of single nutrient formulas, because normally we focus more on the comprehensive, but there is a time and place for a high dose of single nutrients. And for lungs and allergies, breathing, asthma, even COPD, something like N-acetylcysteine, NAC, is fantastic. And you look at that as a precursor for glutathione, but it works extremely well for liver and also lung. Let's talk about that one, Joe.
Yeah, it's a single nutrient, right? So you think, okay, what can a single nutrient do? We're talking about these combination formulas, but N-acetylcysteine, in its ability to be a precursor to our master antioxidant, glutathione, in and of itself is worth the price. But then in its ability to keep the airways clear, working with vitamin C also, today, this is all we have. We have airway issues, we have lung issues, and nobody has enough antioxidants. So just those two things alone make this worth the price.
I'm seeing so many questions from people out there, and look, I'm glad people are taking the time out of their life to actually join us tonight. That really means a lot to me. We invest a lot of time. We got Phil here on the camera. We got Tracey, you and myself, an entire team invested in this. So I love the fact that people are actually participating with this, asking questions. And look, my best answer for all of them is get in to see someone at the Wine and Wellness Center, right? If you don't live in the area, we can do a Zoom, right? We can do a phone call, or we can direct you to a local practitioner, especially on the East Coast, right?
Yeah.
But let's get you in here. I see a woman asking about her 10-year-old grandson, with skin issues. He's on several meds here with creams, with steroids, and nothing's working. It goes away for a short term and returns. So if it's not working, what do you got to do, Tracey?
Do something different.
Yes. Yeah.
Yeah, definitely. Insanity is doing the same thing and expecting a different result. And sometimes the answer is so much simpler than the allopathic model of, symptom repression. So it may be a few dietary changes and nothing extreme, and some nutrient gaps that we need to fill, and he could feel a lot better.
Yeah, I'm thinking so many people used to come in with skin, especially kids. My heart is like, broken right now when I see a kid's suffering, right? And I remember this kid that came in, I was doing consults at the Wellness Center. I remember his name, Anthony. And I used to let kids, I give them the crayons and everything in my office and let them draw. And I always say, if it's really good, we'll hang it up, right? And so you always hang it up. But this kid, Anthony, he came in, Tracey, cutest little boy. He had skin issues so bad. He was 7 years old. He was getting allergy shots, 1 shot a week for 5 years. You remember this kid, right? And I says, well, to the mom, she's a sweetheart. They came over 2.5 hours away. And I says, how many shots will it take for this to clear up? She says, what do you mean? I said, you did 250 shots already. She says, no. I says, 5 years, 1 a week, that's 250. And it hit her, right? I said, is it 300? Is it 500? Like, what's the number?
There's no number because they're just doing what the doctor and their insurance is telling them.
Exactly. And I felt so bad because she was doing what she thought was best for the kid.
Right.
She was so frustrated that he had these skin issues that he wouldn't even take his shirt off at the pool.
Mm-hmm.
Right. So when I worked with him, in 1 month, we got improvement. 1 month. That was it. We showed improvement. Within 4 months, he was ecstatic that he can go to the pool that summer and wasn't worried about his skin, which almost looked like it was peeling off. He had psoriasis really bad. So he had food allergies, right? And we had to give him some nutrients that clear up the fungal infection, right? Like probiotics and something like Microgon. And I remember Doc always telling us, or talking to the patients too, but also telling our team, when they diagnose you, usually the words they're using are just explaining what is going on, right? Like contact dermatitis. He's like, the skin's the derma and the titus is the inflammation. Your skin's inflamed. They're just describing what's going on.
You already knew that.
That's not a disease, right? It's a condition. And I loved how she put suffering with a condition. And yeah, Tracey, explain why giving the steroid cream will help short term, but then it gets worse.
Yeah, so steroids are just going to reduce the inflammation. I mean, obviously that is going to give you a little bit of relief. And then, the antibiotics, which might be a secondary treatment that they're doing for this kid for the secondary infection, because kids tend to scratch it. So really the skin becomes inflamed and irritated because they're scratching it, and you're getting a secondary infection on top of the inflammation. So really it's a gut dysbiosis problem, a little bit of dietary change, probiotics, maybe some GI complete for this kid. And then they can utilize all types of different products like NAC to AirMax to help scavenge up, what shouldn't be in the blood. When I see stuff come out on the skin, I know it's been there a long time. It's been there a long time. So you have, your bowels, your urinary, your lungs, your lymph, and your skin. And when it's coming out on your skin, it means these other 4 pathways of
it can't get out any other way, right? Yeah.
Right. So it comes out. It's the only way left. So it's actually a good sign. Your body doesn't ever do anything wrong. It gives you signals to get where you need to go. So tonight, I think, it's telling you, make an appointment at the Weiner Wellness Center and, get him cleared up. And, I think you'll find you'll get a lot of relief with
doing if you were to see Jeff Nisnik, our kinesiologist here, I mean, he'll test all of these. He has hundreds and hundreds of vials to do kinesiology testing on. So whether it's food, toxin, whatever, he's going to be able to.
Hey, Doc ain't here, but his 50 years of experience is in our blood, right? I still hear him telling me, hey, the top 3 causes. He said number 1 is going to be fungal, yeast, and bacterial infections. Second is going to be parasites, and third would be thyroid and hormones, right?
Yeah.
So every time someone has these issues, I've seen someone with autoimmune conditions. Look, I've been there. That's how I got into this 30 years ago, right? Autoimmune psoriasis, right? Completely changed my life because, like Tracey's saying, it was coming out of my skin. Now, if I got naked here, Joe, settle down. If I showed my skin, it's 100% gone. You can trust me on it. No need.
We'll take your word for it. Okay. Absolutely, yeah.
I'm just giving you, a professional opinion of what's going on. 100% gone. My skin is completely clear from head to toe. No psoriasis.
Nothing.
Clear. I've never seen you so red. What just happened? Look at him.
Me or Joe? He's better than me now. Look at him. I got him, Tracey.
Oh my God.
That's inevitable.
Next formula.
So the psoriasis is gone. I see someone here with autoimmune conditions. We'll get serious again. Autoimmune is the sleeping giant you're going to see more and more of, right? This is only getting worse. Why? When I'm answering Diane's question here. Why? Because think of where the immune system, it's in the intestinal tract. Robert Scott Bell put up that slide at our event April 10th, and that's what we've been talking about for years, right? This mucosal lining, right? The barrier is supposed to allow the outside world to travel inside our body has been compromised, right? And now you have all this overgrowth of bad bugs. You have things getting in the bloodstream that shouldn't be there. And what happens? Immune system activates, and
Starts
now
fighting.
your immune
Starts
system
fighting.
is you have an autoimmune. Think about that. Dr. Watt say there's no such thing. What you have is you have things getting in the wrong place, and now the immune system is hyperactivated.
There's always a trigger. That's the key. There's always a trigger, right? And it's going to be something in your environment, which includes outside and inside your body. There's always a trigger. Like he said, there's no such thing as it's just means your immune system is working overtime. And an old adage from the old martial arts days is you can't fight two battles at once. If your body is fighting this system, this process, what happens when something else comes at you? You're all used up. You're done. You can't fight. That's when most of these autoimmune.
You got to think about the immune cells and the good bacteria. They feed on fibers and short-chain fatty acid. What do the bad bugs feed on? Sugars, alcohol, and dairy products. So if your diet is a sad diet, the standard American diet, well, that's feeding this autoimmune.
Yeah.
We've helped thousands of patients with autoimmune. We're not making any claims. We're just letting you know what we've done. We have a client locally, a great chiropractor and certified clinical nutritionist, that he has over 20 documented cases of MS being fixed, right? So we have the people on our team to help with these things, folks. If a doctor is telling you they can't help you and it is hereditary, the thing you need to do is stand up and say, thanks, doc. I'm going to go find someone that can help me.
Right.
So
exactly.
Call the Wellness Center. We have Dr. Tracey on the team. We have doctors throughout the country to help you out. And we take a lot of pride in how we can help people. It does require dietary and lifestyle changes, but like Tracey would say, if you're really sick enough, you're willing to do anything, aren't you?
Yeah, and it's when you get to that point, it's going to take time and effort. We would rather see you before you get to that point. We want to keep you on the path to optimal health. We'll get you there and keep you there. Don't remember, you can always, like Tracey said, you can always go get a drug. You can always get a surgery. Don't make that your first choice. Let's work on the trigger.
No, we're not anti-medical. What I think has happened is that you look at the medical system, right? It is a miracle worker for trauma. What they're trying to do, Tracey, as you said so many times, is they're treating chronic conditions acutely. It's not working. I always say it's better to have your head split open than to have a headache, because your head split open, they can fix, but they can't help the headaches, right? So if it's a chronic condition, it's not getting any better, you have to try something different.
Well, what did your friend say, Robert Scott Bell, Tracey? The most dangerous thing in America is
a really good insurance policy.
Medical health insurance, yeah.
And you know what? I just had someone come and see me. It was probably 2 weeks ago, in renal failure. They were going to put them on, dialysis. He's like, just wait. And what happened, to be perfectly honest, was he got a pump for his diabetes, and he just thought
diabetic.
It was like free range, right? He could just eat whatever he wanted. That pump controlled his sugar.
Oh, yeah.
So for the first time since he was 12 years old, he had like freedom in food, and he just went a little haywire. Well, it threw him into renal failure because his kidneys were already going downhill for like the last decade. So anyway, simplicity is really where I go with people like that, because you can be like, oh, this is so big, and he was on all these medications. And I was like, you know what? He's nutrient deficient. So I put on flour, cleanse, and lean greens. I did some CircuCore, because I wanted to build the endothelial health, nitric oxide, because that's big for renal health, and a few other things, DMG and a few other things. And, he's doing really well now. So I can't say that we cure, treat, or diagnose anything, right? But we absolutely can fill gaps, and your body has the ability to then do what it's supposed to do, to regenerate cells, to detoxify itself. We have to stop thinking that we're actually like doing something to the symptom. What we're doing is we're establishing a base and a foundation to the body. And so the same thing happens on the flip side. If you are eating poorly, you're sleeping poorly, you're moving poorly, you're thinking poorly, you're eliminating poorly, you're going to be feeling poorly. It's not like, whoa, oh my gosh, why am I sick? So the beautiful thing is that you can change today, right? You can start right now with making a few simple changes that you heard on this particular stream, getting some AirMax, trying it out if you have respiratory issues. If you know that you have skin issues, making an appointment down at the Weiner Wellness Center and take that first step. You may not know what to do, but I promise you there's people out there that do.
And I'm seeing a lot of questions about what product do you have for this, right? We don't get into green medicine. There's no product, and I'm hearing a lot of medications aren't fixing these problems, right? Which are much stronger. So what you got to do is you got to address the underlying cause, not look for the cure. And look, I know people get uncomfortable when you start telling them to change your diet and their lifestyle. Oh, how come Joey's friends can go to McDonald's, but my kid can't? Look, we're just worried about your kid or your body. And it does require lifestyle changes.
Yeah.
If you really want to get healthy, we can help you, right? There's no doubt in my mind. Anybody comes in here, we can show improvement. How quick and how much improvement all depends on the person and how much they're willing to commit. But I'm seeing everything from autoimmune conditions to kids with skin rashes and disease, right? There's all types of things going on that I'm seeing questions on. So let's stop thinking about just a product, but more of a program.
Right.
And that you have professionals here to help you with the program. We're all in the program too, right?
Yep.
And if you want to get healthy, there's a way to do it. And, work with a healthcare professional. They really great people to work with here. Really easy to work with. You can make an appointment. You can come in during the wellness week at no cost and talk to someone and get free testing, right?
Sure can.
We didn't even talk about that.
Yeah, it's coming up. We're starting Saturday. This Saturday coming up, the 8th, we will have the first actual day of the wellness week. We're a little.
Are you open, Joe?
So open. We're never going to leave. Are you kidding? Okay, but we got the first day of the food truck going to be here. We got our free healthy food back. That's here, and you can come in, you can shop, you can talk to the healthcare professionals. Jamie and I will be camped out here the whole week. We'll be here, and then we also have a brand new physician starting at the Weiner Wellness Center.
Drum roll!
Baby, Dr. Phil Ross. He was here today, getting in touch, talking to everybody. He's going to start on Monday.
Is he excited?
You kidding? Energy was flowing off of this guy, and he starts on Monday. So, for the first time in any of the wellness weeks that I can remember, you're going to be able to walk in and get an on-the-spot chiropractic adjustment.
Oh, walk-ins are welcome.
Walk-ins are welcome.
Got food, walk-ins are welcome. We got free testing going on.
Yep.
We'll have samples here, literature, healthcare professionals that answer any questions, discounts on everything. What a great opportunity for the community to come in. And, I'm so excited to see people. I just ran into a couple old friends downstairs. And, Tracey, they haven't been in for over a year. So it was exciting to see them, and I'm feeling the momentum starting to build again. It's exciting to see people.
Yeah.
I think we all need it. The community needs it. So come on down. You don't need to be a patient. You don't need to have been here before. You can come in the first time. Just come down and check us out. Get to meet everybody. And it doesn't cost you anything to come in. And you can experience all types of great things for wellness, great education, all types of samples.
All the summits will be up on the big screen downstairs. You can watch them. Yeah.
So really excited. We got a couple of new formulas. I know Tracey's got a timeline here.
I was trying to hit this. I was trying to hit this.
Oh, there we go. Okay.
Just letting everybody know,
Spring fling. There it is.
Here we go, right?
I'm ready for a spring fling. Are you?
Yes, I'm always ready. It doesn't have to be spring. It can be any time. You can just put fling, right? I wish I could. There's a question here. I wish I could be a spokesperson for the Wellness Center because all the share all the information I receive and people are really waking up to natural healing. Yeah, you are a spokesperson, right?
Right.
We just did.
Yeah, we need more people like that.
Yeah,
right?
we just did.
It's a great job. It's unlimited hours and really low pay. But other than that, we need more spokespeople for the
Welcome
wellness.
aboard, our newest team member, Renee. Thank you.
Renee, we're going to send you some samples. When you come down, we have a special care package for you. How's that, Joe?
Absolutely.
Is that a Louis Vuitton care package for her?
Yeah, but it's really Louis Vito.
Oh, Louis V. A couple. It's close. So Renee, come down if you're in Pittsburgh this week. Diane, come on down. Fitz, you can come too, even though you're in Michigan. So everyone's invited next week.
He showed up before. Don't put it past Fitz. He could be there. So yeah. So our last formula for tonight. We have a few minutes left.
Oh, this is a brand new one, Joe.
Oh yeah.
Right.
You know, we talked about quercetin being in the Immunomax.
Renee's
in the AirMax. It's been in the AirMax for a long time, but you know, it was worth coming out with a standalone quercetin at this point. And you know, like I said earlier, it's one of the few nutrients that outperformed an actual drug in reducing inflammation. I mean, that's just amazing. That? Yeah, right. Amazing. And that's a qualifiable statement. It's there, you know, and I think, Tracey, you know, when we really started looking at quercetin, it was because of the protocols that, you know, you and Robert Scott Bell were putting together, you know, for either if you have suffered from this thing out there or if you have had the jab, you got to do some things. And quercetin was at the top of the list for that, for endothelial health. And that's N-acetylcysteine, sorry. There it is. Quercetin. Okay. Yeah. So we know, you know, endothelial health, that's the lining of the capillaries. It has to be at top notch in order for you to get oxygen through to the blood, into the blood through to the body. So increasing endothelial health is one of the main things quercetin does. And Tracey, you guys put it in the protocol for that reason and more, right?
Oh, absolutely. And it just enhances L-arginine, which helps raise nitric oxide in the blood. And we coupled it with Circucor. So, you know, it's a very powerful protocol and it does work. And if anyone's interested, you know, they can always contact the Weiner Wellness Center and they can bundle that protocol for you together.
Yes.
But, you know, I was looking up some things on quercetin as well, and it's been studied more as an antihistamine. So that's great. Yeah. So Jamie, go ahead and elaborate on that, because that's an important part of everything we're talking about with allergy season, because the hive thing that's happening after COVID is one of the side effects. Because
what did you say?
I said
what effects?
Side effects. Direct effects.
There it is.
Well, I'm not talking about the jab. I'm talking about COVID. People complaining that now they're starting to get allergies. And we know from when we lectured in April that it's just systemic inflammation that they need to get under control, because that, you know, that RNA virus deregulated all of their, you know, ability to rebalance the inflammation factor in macrophage 1 and type 2. So quercetin can be excellent for that if you're experiencing hives after COVID. But go ahead, Jamie, elaborate more.
No, it was on my mind before about the Benny gut, and I forgot. But they both work very similar manner. The mechanism of action is that they're antihistamines and anti-inflammatories. So you get the both pathways being fed by not only the quercetin, but also the Perilla seed extract. And that's why they're so effective for multiple reasons, right? So you're talking about endothelial cell function, anti-inflammatory, reducing histamine. So
improving nitric oxide.
Yeah. So folks, when if you say, oh, well, someone told me quercetin is great for allergies, and someone else told me it's great for antihistamine, and someone else said it's great anti-inflammatory, they're all right. Right? It can be applied. And that's a great thing with a lot of nutrients is they have the PSEs, Joe, which are positive side effects, right? That's the benefit of a lot of nutrients and that's what you get to when you go on a wellness program. Anyone can take a vitamin. Go on a wellness program and you start to get all these effects across the board that are just cumulative over time, right? You get better and better. And that's why we do the wellness weeks, because where else are you going to go to have a wellness experience? And I always ask the question, when you expose to wellness compared to now, are you doing more things for wellness than when you first got exposed? Of course, because it's so positive. Right, you started martial arts and then got into vitamins and nutrition and water and health and, you know, infrared saunas. It just grows and grows and grows. And that's the whole idea of having the wellness weeks.
Yeah, it is. They expose you to as much of this as possible. The virtual summit, it just took everything to a new level. You know, the biggest silver lining that we've experienced in this last year was the virtual summit, bringing in these great speakers from all across the country. And just, you know, that took the information cascade to a new level. Really did.
Are you still on the schedule, Joe? I know there's a lot of competition.
Hey, I somehow got a couple of Saturday spots.
I saw. I'm not on the side. That's okay. If I am, it's early in the morning.
You weren't quick enough.
I'm not complaining.
Okay, I'm gonna just say, in all fairness, I sent everybody the link at the same time to reserve your spot.
I happened to get.
I didn't know it was a speed competition.
You weren't quick enough.
I was busy. Can you
But
believe
my
that?
most faithful and compliant two, Dr. Honigman and Joe, got the Saturdays.
All right, no problem.
Because they
Someone
clicked
got to
the
work.
link first. So no, this has been incredible. I think you have really helped a lot of people with something that's very common and accepted, but shouldn't be. And just so people know here tonight that there is a way that you can feel better, just doing some simple things. And if you really want to get to the root of the issue, I would highly recommend you go and you schedule a session at the Weiner Wellness Center. We have so many great practitioners there. And just since we've been talking about inflammation so much, if there's anybody that wants to attend our next professional.
Oh, look at this lineup.
Thursday, July 29th. This is Dr. Richard Silva and Polina Petrusevich, and they're doing diabesity. And we know that during COVID, the highest risk population were diabetics. And it was because of everything we talked about tonight. It was because they were already pro-inflammatory. It was because they were already sick. So if you want to learn for yourself, for your patients, for a family member, you sign up. You can go to the Nutritional Frontiers website. It's www.nutritionalfrontiers.com. Click on the events tab and you can register. Anything else?
No, thanks so much for having us on tonight. I love working with you guys.
We're in Studio 109, everybody.
Can you see Studio 109? The infamous.
We have our director and producer over here. Phil, come on over here. Get a camera.
This is Philly Phil, everybody. Come on over.
There's our producer. Hey, Phil.
He looks like Dr. Weiner's
His nephew, Phil. Yeah.
He was so hesitant to get in that frame.
Oh, I know. I looked up and there he was. Yeah, not joking. This guy, man, you asked for something, he's on top of it. So thanks so much for Phil making us look so good, or at least Joe look so good. So we're excited to see everyone this weekend. Come on down for the event. We're excited. Hey, Bill, your fans are calling you Bill, Phil, whatever. So everyone's saying hello to Bill. It's Philly Phil or Philly Bill. Either way, we're good. So come on down to the Wellness Week. If you like what we're doing, bring a friend, bring a relative. I know sometimes breaking the ice at a natural wellness center is a little newer to them. Bring them down. We like to have fun, and we'll get you on your path and journey to wellness.
Yes.
Thanks so much, everyone. We appreciate all the support. Have a great night. God bless.